question, and I'm going to try to answer it in two parts.
Okay.
The first part is actually one that is really important. Often we experience something traumatic, but we don't call it traumatic. So we might experience something like a natural disaster or an accident, or experience physical or sexual abuse, or experiences during combat, and not actually call that a traumatic event. We may actually rationalize it as like, oh, that was happening to everybody. This is normal in my background. And we might minimize the event itself. So that's probably the first step to realize that I have to show kindness to myself and realize that, yes, I went through something really impactful. This event changed me. So that would be the first step. The second one, looking at common signs, and these are also part of some of the symptoms that an individual would experience. These would be intrusive memories of the event that I'm not trying to recall, but they just kind of rush into my memory or my thoughts. These can be also called flashbacks. Individuals can experience flashbacks of the traumatic event, have nightmares, very common, and experience some level of avoiding or avoidance, meaning avoiding the individual or individuals similar to the ones that may have harmed me, or avoiding the spaces and places in which the trauma had occurred or similar to those. Very common and very much outside of our common thinking is numbing. We may numb our emotions, we may numb our experiences, we may even feel a little detached from those types of memories. Experiencing hyperarousal would be like, I'm particularly scared, I'm particularly vigilant, are also very common. Some that may be present in some cases is being distrustful of others, especially if the trauma was relational or somebody that we knew or trusted and that person hurted us. That can lead us into develop a little bit of difficulties with trusting other individuals. The last one would be physical signs. Some of these physical signs could be associated with health problems as well.
And so throughout this series, our main focus has been mental health and mental health access for men. And so I just want, and we've tried to ask this of all of our guests that we've had so far, but in dealing with your clients that are male or identify as male, do you find that they are maybe more hesitant to talk about trauma, or to maybe even admit or want to go back to those memories to try to deal with trauma? Is that a fair statement?
Yeah, no, that's a great point. And although, the diagnostic process is similar to both men and women, and there is a higher number of women that experience post-traumatic stress disorder and trauma in our society, for men, one of the difficulties is our socialization tends to cause problems for seeking help. So I observe that it's very difficult for men to seek help when they're first noticing symptoms. Men tend to wait much longer or to be experiencing much greater amount of distress before they seek help. So that would be one. Emotionally speaking, we're also socialized to kind of have one emotion, and that's anger.
Yes, yes, exactly. We've explored that a little bit in other conversations.
Exactly.
Yes.
So, it makes it really hard for us to even to know, like, is this trauma or is this a question of anger management? Right? So often the treatment of trauma for men happens when other treatments have occurred. like treatment for substance use disorder
Okay.
or anger or depression. After those processes have begun, then the trauma is uncovered often.
Okay.
So that's where often men will experience or be more aware and open to this kind of treatment. But yeah,
Right.
that's a great question.
Yeah. And the other thing that we're hearing through our previous conversations is I want to talk about specifically immigrant communities in Nashville.
Mhm.
We're hearing things that uh, mental health may be something that is taboo in certain realms, or that maybe even folks in those communities don't even know how to access mental health, or that they need to access it. And I just wanted to just sort of ask you maybe your experience with that. How do we get the word out to different communities that there are places you can go for help, there are places to go that maybe don't only speak English. There are resources out there, but I guess I'm interested in how do we get that message out to them, and how do we just make this accessible to them? Uh,
Yeah.
yeah.
No, thank you for going into that. And one of the areas that I've been really focused on through my academic work is the integration of mental health and primary care.
Okay.
One of the things that is really important for us to recognize is for many individuals, the first place that they will go to seek help will be their medical provider,
That makes sense.
right? So there is a little bit of responsibility on the the provider community to be present where the patients are, rather than waiting for the patients to come to us.
So like outreach efforts.
Exactly.
Okay. All right.
So a lot of the work would be for a mental health provider to be present in primary care settings. And in our city, there are several places that is already a reality. Matthew Walker Health Center is
Yep.
one of them. Neighborhood Health is another one.
Okay.
Mercy in Franklin is one. Connect Us here in town. Siloam is another one. These are all places that an individual will go initially for physical health, which is usually how trauma shows up first, some of the physical difficulties, but then they will be ready to help those individuals move on with their treatment and recognize that mental health is health.
That's important. I think
Mhm.
that's a really important message, and we're trying to help be a part of that, and get
Yeah.
that out there to people.
Hmm.
Um, you talked about trauma can oftentimes have a physical manifestation. Um, I guess for anybody watching this interview, um, how how can trauma show up physically, but are there other ways it can show up, and what might that look like for folks that really maybe don't even realize they're suffering from trauma? Well, how would they maybe self-identify some of
Yeah.
the things they're experiencing?
No, that's a great question. And I'll start by saying that the experiences of trauma are very individually based. So I will
Okay.
share some of the things here, but it doesn't necessarily mean that someone needs to experience all of them or that they have to occur in this order. For some folks, it's just going to be unique. But one that shows up a lot is difficulties with sleep or sleep disturbances.
Okay.
So difficulties falling asleep, waking up throughout the night, not being able to return to sleep. That would be one that, it's part of your physical well being. Muscle tension and pain is another characteristic or ways in which trauma shows up in the physical body. Gastrointestinal difficulties or irritable bowel syndromes, difficulties with the gastrointestinal system very much shows up with individuals that have a history of trauma. Cardiovascular disease or issues can also be associated with trauma. even impacting someone's immune system and their ability to recover from disease can be impacted by trauma. And maybe one of the big ones that is also important to think about is substance use. Substance use disorders um, will definitely be significant here. Now, these are on the physical side of things. There's also, on the mental, the emotional side. How they show up would be through flashbacks, like I mentioned before, avoidance, negative changes in mood and thinking. Often folks will experience seasons of depression, heightened anxiety, being hyper aroused, being hyper vigilant, difficulties concentrating, and emotional instability, like shifts, and can be very much connected to a history of trauma.
That's great information and,
Yeah.
and very fascinating. So if someone is going to maybe a primary care physician for, let's say, gastrointestinal issues or trouble sleeping, um, are in your opinion, are our primary care physicians, are they tuned in to physically everything seems to be fine, although you're suffering from these ailments? Are they trained, or are they trying to help push? Maybe this is maybe this is a trauma that you're really dealing with. Maybe this is a
Mhm.
mental health issue that is just showing up physically. I mean, so if someone at least went to a primary care physician as a first step,
Mhm.
do you feel like here in Nashville they know to try to elevate this to something in the mental health world?
Yeah, that's a wonderful question. And all professionals, and this is a shift in our fields, in the healthcare field, is a great movement into interprofessional training. So, as a person in mental health at Lipscomb University, I have partnerships with folks at Meharry Medical School,
Okay.
Vanderbilt, and the effort is to actually train all providers, all healthcare providers, to have that sensibility. Because what we've noticed is if we are siloed, we're often missing things.
Sure.
So I will definitely encourage all those that are watching to, yes, do talk to your medical provider. Do talk about your health issues with your mental health provider. And, and there will be communication. There will be opportunity for those things to be explored. Now, I will say that it's important that we trust our providers and that we share with them to say, like, hey, I don't know if this is connected, but I often have difficulty sleeping and I'm waking up because I'm having nightmares about this experience that happened to me. Or, hey, this happened to me. I don't know if this is connected, but I just wanted to let you know. To being trustful of your providers can be super helpful in helping them connect the dots. But yes, at a most basic level, providers should be able to make those connections and see, oh, this physical ailment is connected to a mental health um, trauma.
That's
Mm-hmm.
I think that's a great distinction. I was just at my primary care physician a couple of months ago, and I think for me, when I go in, it's almost like I'm taking the car into the body shop. It's like, well, this hurts and this hurts, but I don't know that I necessarily think to talk to him, my primary care physician, about mental health things, even though
Yeah,
that makes sense. And so I think even getting that message out to people is an
exactly.
important thing to hear. I
Mhm.
think we might take that for
Yeah,
granted.
and it would be something like, your car check light shows up, is on. It would be helpful for you to let them know, like, hey, by the way, I'm also hearing this noise when I turn left. Would you check that? It would be something like that. You go and you see that provider as someone that will be the door into a really big um, center of opportunities. your provider will actually help you connect with other providers. And if you have that sense of, oh, this is the first door, and this person will help me connect, then you'll be more likely to say, yes, I'm doing my annual. They may not have asked about your sleep, but you might say like, hey, I'm been feeling more down than usual. Would you have a conversation about that? And
That's great.
yeah,
So if I'm watching this
yeah,
right now, and I'm listening and hearing you say things like, well, I do have this experience from childhood that will just pop in my mind every now and then. I'm not thinking it up. It just sort of appears, and and then I maybe I do have trouble sleeping, and some of the things that I'm hearing Dr. Ribeiro say, some of those things are clicking with me right now, and so
yeah,
am I suffering from trauma? Am I suffering from PTSD? Um, I think for anybody that is maybe feeling a light bulb go off, could you talk to us a little bit about how you work through trauma,
mm,
or if it's PTSD, what does the work look like to try to, I don't know if it's move through that, process that, make that less painful and impactful. I'm not sure if I'm using the right
no, this
terminology
is
there, but
super
but
helpful.
but but how would someone they maybe are identifying that now? What does it look like for them to sort of try to work through that? If you could talk to us about, techniques or trips.
Hmm. I would say that the first thing would be to recognize that trauma is treatable. It is a condition that we as a discipline, as providers, we know how to treat it. And to seek out the counsel of a trusted provider will be the first step.
Okay.
To help you see like, hey, I'm feeling these things, I'm making these connections. I would like to talk about it and explore. And that professional will be able to assess if this would meet criteria for a post-traumatic stress disorder, or is this an adjustment to life? Is this an acute stress disorder? Is this depression? Is this anxiety? So the provider will walk with you through that clarification process. But I think the first step for me would be to recognize that I'm noticing something. Let me go seek help. Now, as you're navigating the treatment of trauma, there are many modalities of treatment, but most of them will be associated with some level of exposure to the psychological trauma. And the exposure wouldn't be like, okay, let's go back to that place, or but really an exposure to the emotional and psychological tensions that come from that experience. What we've found is that as we expose ourselves to it, we the experience itself loses its intensity,
Okay.
right? So automatically we want to avoid it. But the reality is the healing comes from our body recognizing that we're not in danger today. Which leads us to the recognition that for many individuals and many of you that might be watching, you might be in a situation that you may not be safe or feel that you're safe. And that would be the first step, would be to seek help so that we as a community may be able to help you stay safe. And that is a critical aspect of this work, that trauma treatment doesn't start while the person is still being traumatized.
It's an important distinction. Yeah.
Right? We want to make sure, and as providers, we have a commitment to our patients and clients to help them connect with resources so that they are safe to begin with.
And I loved what you said a moment ago, that trauma is treatable. I
Mm-hmm.
think that's important. I'm in my mid 40s, and growing up, I never heard that.
Yeah.
I really grew up thinking that trauma is a burden, something that you just have to live with,
Yeah.
and that it's just part of it. And I think as we've had advances in all different aspects of medicine and healthcare, I think we're seeing that yeah, that's not the case. You don't have to suffer. It is
Exactly.
treatable.
And I'll add to that that I've had patients and clients that I've worked with that experienced trauma in their childhood, and we did and went through treatment when they were in their 60s and 70s. So even though you may have learned how to survive or be okay with those experiences, treatment will help you thrive. It will actually help you feel free to engage and connect in ways that you may have not been able to.
That's great.
Mhm.
Um, I'd like to shift gears
Yeah.
just slightly, and I'd like to talk about if someone is watching this and maybe they themselves aren't suffering from trauma or post traumatic stress, um, but they have a loved one that they think is showing signs of definitely trauma or PTSD. How can someone help a friend, a family member, a loved one? Eh, I know obviously that the person suffering needs to, take that first step and try to get
Yeah.
help. But for a loved one, a lot of times it can be difficult to watch this person suffer through that. We've talked about how it can show itself in mental aspects of mental health, physical health. But if you have a loved one that you think is suffering, what can you do? Is it best to try to be a silent supporter? Is it best to try to push them to seek help? Any strategies
Yeah.
on that?
No, thank you. And that's a great question. And I would say that watching this, participating in this event is part of you educating yourself. And I think that would be the first thing that I would recommend folks to be thinking about is what can I learn? This is not something that I experienced. How can I learn? What would be helpful for me to know? I think the second one, and I have a list of things that I would like to share, is to be able to listen without judgment.
That's easier said than done sometimes, especially
Yeah,
when you're really close with
exactly.
someone. Yeah,
Sometimes we want to rescue.
sure. Yeah,
Sometimes we feel uncomfortable, right? And
yeah,
we just don't want to hear this feels really overwhelming. This happened so long ago. Why are we talking about it? But to be able to listen without judgment and know that when that person finishes saying what they need to say, to be able to ask, how can I be helpful? Right. Another piece is to be patient. You know, the person experiencing the trauma or the flashbacks or the intrusive thoughts, they are overwhelmed themselves. So it really helps being patient. Another way, like I mentioned, to ask and to offer practical support. Often, would you like for me to get you some water? Would you like to sit down? Could we take a moment to pause? That might be super helpful. Also, respect when somebody experiences something that makes them recall the trauma and know that, yes, I'll respect this. It may not, a trigger could be like a smell,
sure.
right? This smell might not have the same trigger for me as it does for the person that experienced the trauma, but I have to respect that trigger, right? That this is a powerful experience for this person. Learn coping strategies together, like breathing exercises, going on walks, silent meditations. Be mindful of language. Sometimes trauma occurs and there are words that are associated with the trauma, and to be mindful of that. Encourage self care. Often people think that to take care of themselves is a selfish thing.
Yeah, I'd like to debunk that myth. If
Exactly.
anybody is thinking
And
that's not
and
true.
I will say that being selfish exists. There
Sure.
are times that, but to care for yourself and to be able to show kindness to ourselves is extremely important, both as a person that is helping, but also the person that is experiencing or has experienced the trauma. Um, and then stay informed about treatment and care, right? If your partner or someone that you care about, they're going to treatment, ask that person, walk with that person, ask them how much would they like to share about their treatment process.
I'm a big believer that when you speak things, it sometimes will lose power.
Mm-hmm.
And so I think if you can get someone to maybe, if they feel safe and comfortable, if they can sort of talk through what they're going through, that a lot of times that can be helpful, or at least a first step.
Most definitely, yeah.
If trauma goes untreated,
Mm-hmm.
or you just are not ready to make that first step, or maybe it's just too painful and raw and you're just not ready to deal with it, can you talk a little bit to us about what that can look like if trauma goes untreated? I would assume or guess that that could lead to things like substance abuse,
Mm-hmm.
just different ways of trying to mask. And you mentioned numbness, numbing
Mm-hmm.
things earlier. But are there other ways that not dealing with trauma can manifest either physically or mentally?
Yeah, so often what we see is, let's say if someone has post-traumatic stress disorder and they don't treat that, there will be a worsening of symptoms over time. Now, some of that will impair or impact the person's functioning, so their ability to work or to be productive at school, that will be impacted. Another piece that might cause social withdrawal. The person might actually remove themselves from social interactions that they might really enjoy, but they might withdraw. There are some physical complications that can come, like chronic illnesses can be impacted. I've talked a lot sleep. Think of someone that is having more and more difficulty with their sleep. That will impact their day significantly. You mentioned substance use. Substance use disorders will be definitely a risk, an increased risk. And what I like to tell folks, often that is initially at the beginning is an attempt to self-medicate and an attempt to heal.
Yeah.
That it's a solution that becomes a problem. So often when someone is experiencing some sort of substance use or addiction, there's so much shame around it. But it's helpful to know, like, oh, this is coming from a place of wanting to solve a problem, and I'm actually, now stuck with another problem.
Right, and it just has
Mm-hmm.
complicated everything.
Exactly. Mm-hmm.
I'd like to talk just for a moment about social media, because
Yes.
that really impacts so much of our daily lives, whether we realize it or not. But I would like to talk about how the things that we see on social media, just as an example, over the last probably month, on my Instagram feed, every now and then I will see horrible videos of
Mm-hmm.
the things going on in Gaza right now, and the war over there, and you'll see maybe children or people that have been killed, and we all maybe see things like that. And as you're scrolling, something we think is so simple, but that stuff has to sit with us. I mean,
Mm-hmm.
it's really hard to just forget that you didn't see that. And
Mm-hmm.
so I guess I want to ask, what effect do you think social media is having on our mental health, number one? And I think it's
Mm-hmm.
probably not great. But as far as trauma, like when I see things like that, is that a traumatic experience for me and others
Mm-hmm.
that may see that? Or just any sort of thoughts you have on that?
Yeah.
I'm really
No, I
curious about
appreciate
that.
I appreciate that. And I think one of the things is that idea of a trigger. You know, for some of us, we might be watching or seeing something and see a picture of a child, and that is exactly what happened to us as children, right? So that
Yeah.
will be an immediate connection to our own trauma. So that's important to recognize that vulnerability and to be cautious about this tool that we have.
Yeah.
I would probably argue that there are some triggers. There's also potential of cyberbullying,
Oh, sure. Yeah.
right? I might make a comment about a post and receive a lot of negative feedback from that comment. I can get overwhelmed by information. You know, social media, the algorithms are designed to keep me connected, which can actually cause me to feel overwhelmed with all of this
Oh,
information.
sure. Yeah.
Now, I will also say that not all of it is negative, that there are some really positive things that I've seen in social media, even associated with trauma, like connection and support with other individuals that have experienced something like I may have in the past. So that can also be available. Access to resources often comes through social media, the availability of things. Awareness and advocacy can occur through social media, so I can speak up and be able to change how things are maybe shaped in our society. So that, you know, it's an important thing to consider. Now, in terms of how to use this tool in a healthy way, I would recommend try to curate your feed.
That's important. Yeah.
You know, to maybe recognize that if I'm teaching the algorithm what to give me, and I have to be able to teach that algorithm well. I need to create it so that the information that comes my way is more balanced to my desired experience of that software. To set boundaries, you know, maybe there's a time that you're more vulnerable, that you're like, you know, this is not a good time for me to seek out rest in
Sure.
social media. Maybe I need to go on a walk. Be mindful of interactions. You know, people tend to be much harsher in their social interactions through social media than they would in person. So just remind that. Balance online and offline connections. Make sure that you're thinking about the amount of connections that you have. And then talk to your provider about your social media and how social media is impacting you. That person might be able to help you develop some of these strategies on a one-on-one. Mm-hmm.
That's very helpful.
Yeah.
I appreciate that. Um, I also want to ask, and you've touched on this, but I just want to just ask it in a different way. What is the difference between, do I have PTSD, or is this just cyclical thinking?
Mm.
Like if I, keep thinking about a childhood experience, and maybe it wasn't that negative, but I just think about it all the time, or I think about a conversation I had with my parents. The fact that maybe keeps coming up over and over again, is that cyclical thinking, or is that a form of trauma in a way? And when we were trying to formulate questions about this session,
Yeah.
that was one thing we were thinking about is am I just I've got a great memory, and I just can recall things that happened years ago, maybe good and bad, or is that unrecognized trauma and I just don't realize? And we thought that was a sort of an interesting
Yeah.
take on it, and I don't even know if that's a good question, but I would
No,
love if
no.
you have any thoughts about that.
Yeah, so that's a great question.
Okay, good.
And, you know, cyclical thinking or rumination
Ruminate,
is a
yes.
symptom that is associated with post-traumatic stress disorder, but is also associated with depression and other mental conditions. What I would encourage people to think about is this. There's one thing about thinking about something and being curious and exploring and having a good memory, and those are all normal experiences, and all of us experience them. And there's a piece of it that is really nice to be able to think about things or remember someone. Or when I think about the unhelpful part of cyclical thinking, or the impact of rumination, is when I feel that I'm stuck in that
Okay.
state, right? That one thing is for me to think, I have this problem and I'm going to try to solve and think about this problem and try to resolve it. Another piece is I am stuck with this thinking and I'm unable to stop it. I actually cannot step away from my own mind. Rumination often starts as an attempt to solve a problem, and we feel like it's helpful. I need to find a solution. But the reality is often in that I'm looking for a solution within and I'm not seeking external information. I'm actually hoping that I'll find something new, but nothing new is coming in. I'm actually stuck inside. So that's when it becomes unhelpful. That's where it becomes more of a concern, because then my mind is really unable to walk away from that process.
And that seems to be the distinction.
Mhm.
Okay, that makes
That's
a
what I would, if I'm, watching, if I'm thinking about this would be something that, oh, if I can't walk away from it, if I feel like I'm trapped within this cycle, that's where I would probably need outside help in order to mitigate that problem. Hmm.
Um, another question that I have, is trauma something that can be passed on through childbirth? And that sort of leads into an idea of maybe generational trauma, and I guess I mean unhealed trauma. But is that something that can be passed down? If my grandfather had things that he didn't work through, could that have been passed down to me in some way? And I don't ask that to try to uh, victim blame, but is that something that is there science behind that shows that yes, the trauma is in our DNA and in our cells, and yes, if it is unhealed, it may have been passed on to us, it may be passed on through us to others, but if anything, you could maybe speak on that. I think would be
Yeah.
really interesting.
So this is a really interesting question, and a question that we often ask because we're concerned. We're concerned about those that we were raising. I have three boys, and I'm thinking, okay, so what does this mean for them if I have experienced
Yeah.
something traumatic? And there are some really interesting studies that have looked at women that were expecting during in New York during 9/11 in 20, 2001, and how that experience impacted stress hormone levels of their children. And one of those studies showed that there was a connection. Although I don't think the literature is very clear, and we don't know exactly how that impacts the person's whole life, and if the child will have post traumatic stress disorder because the mom had it. I don't think we are able to assert that.
Okay.
However, what we can say is that there's a really long literature on historical trauma, and this would be trauma that is associated with, let's say, the impacting of a whole culture or a whole community, and how history of slavery may impact the lives of generations that come. Um, and those are both biological and social that need to be recognized um, as important to those communities. Some of the things that you can see is, there's transmission that occurred through generations, especially if I don't have the ability or access to treatment. Many of the symptoms that I'm experiencing from my trauma will impact my ability to parent my child and to be available and present for the needs of my children. Those are not necessarily like, and I appreciate what you said in terms of blaming the victim but actually recognizing that when systemic trauma occurs, there will be systemic consequences. And we should be thinking about healing not just at the individual level, not just at the family level, but also at the societal level, right? That there is transmission of that trauma over generations. There's also cultural disruption. Cultures have their own ways of healing from trauma, and sometimes that's lost. And then the general impact on mental health of a family system can be significantly impacted by trauma.
I know that earlier in our conversation, you had a list of local resources, but
Yeah.
I would sort of like to sort of wrap up my line of questioning, and if you could you maybe share those resources of places that people can go here in Nashville to seek help for trauma? And I just want to repeat, maybe for the third time, that trauma is treatable. I think that if there's any takeaway today, I think
Yeah.
that's a big one. And so I just want to make sure people are hearing that. But where are some places that people could go, maybe as a first step or an introduction to trying to identify trauma, PTSD, and places that could offer help and support and kind of guide them through working through
Mhm.
that?
I would, like we talked before, I would start with your primary care physician.
Right. Yes.
I would start with, if you're already in counseling, talk to your therapist
Sure.
about maybe some previous experiences that maybe this conversation has brought up, and be like, hey, I would like to talk about that. Other resources are the Mental Health Cooperative here in town. Very well-trained individuals that will be ready to support you. Centerstone Military Services. They will also have some really amazing resources. The Tennessee Veteran Services. This is Tennessee Department of Veteran Services resource. The VA, for those that are in the military, would be an incredible place. Vanderbilt Medical Center, they have a psychiatric department there. The Tennessee Suicide Prevention Network, and I know that you guys have already talked about suicide. Very important that you have those numbers and easy access. There are a couple of unique ones that I think would be helpful to share. Thistle Farms, they also provide some resources, and then Nashville Cares. Now, Nashville Cares primarily service HIV and AIDS, but they do have resources for individuals that are also experiencing a history of trauma. So many nonprofits, they will be a great resource to make those connections as well. And then I mentioned, the primary care clinics that are serving the community would be a place to go as well.
That's great. Thank you for sharing those. I'm just going to go offline for a second. And do we have any questions from our live audience? Seeing none, we do appreciate Dr.
Thank
Rivera. We
you.
appreciate your time today. Thank you for so much for talking to us. Again, for the last time, trauma is treatable. So we we've heard a list of resources. You may find other options, but please know that trauma is not something that you have to suffer through silently. There is help out there, and hopefully today we learn more information, and hopefully you can find your own journey and your way to take those first steps. We're going to close with that. And again, this is the Nashville Public Library, and please remember that your mind matters. Thank you.